guys, today I will be your alpha-glucosidase inhibitor. Now let's get to know me. Now let's begin with my drug name. For my generic name, I am known as acarbose miglitol and miglitol. My chemical name is quite difficult to read, so here it is. I have several brand names available both here in the Philippines and internationally. These are the Precos, the Glycet, the Glucobay, and the Glucovate. For my therapeutic classification, I am classified as an antidiabetic and hypoglycemic. For my pharmacologic classification, I am classified as an alpha-glucosidase inhibitor. My pregnancy category falls to the category B, which means that animal reproduction have failed to demonstrate risk in fetus and there are no adequate studies in pregnant women. Now, how do I work? Let's begin with this glucosidase enzyme. Glucosidase is an enzyme that can transform complex carbohydrates into basic sugars. Now alpha-glucosidase inhibitor helps by suppressing this glucosidase activity. Through my help, there will be an inhibition of the passage of the basic sugars into the blood from the small intestine. However, alpha-glucosidase inhibitor cannot stop the movement of the other basic sugars found in foods like cakes, sweets, and honeys from moving into the bloodstream. Now let's go to my pharmacokinetics. Now let's begin with absorption. Alpha-glucosidase inhibitors is greatly absorbed in the GI tract. My time to peak in the plasma concentration is within 1 to 3 hours. For my distribution, I cross the placenta and enters the breast milk in small amounts. Greater than 4% of me binds with plasma proteins. Now, a part of me, acarbose, is metabolized exclusively via GI tract, principally by the microbial flora and intestinal enzymes. Miglitol, on the other hand, is not metabolized. I am excreted via urine and feces. Miglitol is excreted via urine as an unchanged drug. Now alpha-glucosidase inhibitor is indicated for the treatment and management of type 2 diabetes. Type 2 diabetes is a condition where your body doesn't use insulin properly, resulting to an unusual amount of blood glucose level. Now, just like any other drug, I also have my contraindications. Now, these are my contraindications. Alpha-glucosidase inhibitor is contraindicated to patients with inflammatory bowel disease, diabetic ketoacidosis or cirrhosis, colonic ulceration, partial intestinal obstruction or predisposition to this condition, chronic intestinal diseases associated with marked disorders of digestion or absorption, and states which may deteriorate as a result of increased gas formations in the intestines. Lastly, I am contraindicated to patients with severe hepatic and renal impairment. Now let's go to my side and adverse effects. I may cause gastrointestinal disturbances such as abdominal pain, diarrhea, and flatulence. I may also cause liver impairment, a decrease in serum iron level, hypoglycemia, and vitamin B deficiency. Lastly, alpha-glucosidase inhibitor may cause skin rashes. And now, let's go to the nursing responsibilities. So we have the before, during, and after administration of alpha-glucosidase inhibitors to the patient. So before the nurse administer the drug to the patient, the nurse must make sure that the patient is not hypersensitive to the drug and that the patient doesn't have any of the contraindications to avoid further complications. The nurse must also avoid using the drug in patients with serum creatinine levels above 2 milligrams and in breastfeeding or pregnant women. The nurse must also make sure to use the drug cautiously in patients with mild to moderate renal impairment. It's the nurse's responsibility to make sure that patient knows what the drug is for. Make sure also that the patient is ready for the drug therapy and to tell the patient to take drug with the first bite of each of 3 main meals daily. Now
Now, during the administration of the drug, the nurse must implement aerobic exercises and endurance training programs to maintain optimal body weight, improve insulin sensitivity, and reduce the risk of macrovascular diseases and microvascular problems. The nurse must also encourage patients to monitor blood glucose before and after exercise and to adjust food intake to maintain normal glycemic levels. The nurse must give emphasis to the importance of adhering to the nutritional guidelines and the need for periodic assessment of glycemic control throughout the management of diabetes mellitus. The nurse must advise the patient about the symptoms of hyperglycemia like confusion, drowsiness, flushed and dry skin, food-like breath odor, rapid deep breathing, polyuria, loss of appetite, and unusual thirst. Drug dosages may need to be adjusted to prevent repeated episodes of hyperglycemia. Lastly, the nurse must instruct the patient to report troublesome GI problems, including severe or prolonged diarrhea, flatulence, and abdominal pain. Now, after the nurse had administered the drug to the patient, the nurse must be alert and the nurse must encourage the patient to report for any signs and symptoms of hypoglycemia, especially during and after the exercise. Common neuromuscular signs include anxiety, restlessness, tingling in hands, feet, lips or tongue, chills, cold sweats, confusion, difficulty in concentration, drowsiness, excessive hunger, headache, irritability, nervousness, tremor, weakness, unsteady gait, and report persistent or repeated episodes of hypoglycemia. The nurse must also assess the blood pressure periodically because a sudden or sustained increase in blood pressure may indicate problems in diabetes management and should be reported